Thank you for your introduction. I'm Dr. Gu from Nanjing Tower Hospital. I'm glad to be here to share the results of our clinical trial, the SPACE-5 study. So as we know, it's well recommended by different guidelines that when we choose the anti-diabetic agent, a patient-centered approach should be used. That means consideration of the efficiency, impact on the weight, as well as hypoglycemia risk. So in this study, we conducted this 14-week multi-center open-label randomized parallel clinical trial in aim to compare the efficiency and the safety of saxagliptins and glimepiride in type 2 diabetes patient in adequately controlled with metformin monotherapy in a Chinese population. And our primary endpoint is a composite endpoint that's including the HbA1c less than 7% without hypoglycemia, which was defined as blood glucose less than 3.9, and no weight gain. That means weight gain less than 3% after 14-week treatment. So a brief research design that the inclusion criteria consistent of the type 2 diabetes patient, age between 20 to 65, and baseline HbA1c between 7 to 9.5, with a stable dosage of metformin over 1,500 for at least 8 weeks. So after 1 week run-in period with a stable dosage of 1,500 metformin, the patient will randomize to two treatment group for 14 weeks treatment. And this is the key information of our baseline clinical characterized. We could see the age is around 52 to 54, and the duration is around 5 years, and BMI is around 25, and the baseline HbA1c is around 8%. Now let's see our results. We could see the primary endpoint over the 48 weeks. The greater proportion of patients achieved the primary endpoint in saxagliptin group as compared to glimepiride. When we did the subgroup analysis, we could see in the patient with baseline HbA1c less than 8, and all the type 2 diabetes duration less than 5 years, or baseline BMI over 25. We could still see the significant difference, but not in the other group. What's more, the mean dosage in glimepiride treatment groups was 2.5 milligram daily. For the glycemic control, we could see that the mean reduction in HbA1c was similar in two treatment groups at week 48, also in different subgroup in the subgroup analysis according to the baseline HbA1c. For the body weight change, we could see over the 48 treatment period, in glimepiride the body weight increased, and in the saxagliptin they decreased the body weight. For the glucose, we could see that there was significant difference at the 2 hours postprandial glucose, but not in the fasting glucose. Regarding the safety analysis, we could see the proportion of patients experiencing hypoglycemia was much less in saxagliptin group as compared to glimepiride, and further analysis indicate this hypoglycemia mainly existed in the level 1 according to the ADL classification, but not in the level 2 and severe hypoglycemia. So to summarize, saxagliptin more efficiently achieve a composite endpoint of adequate glycemic control without glycemia and no weight gain as compared to glimepiride in type 2 diabetes patient inadequately controlled with metformin monotherapy, especially in the overweight patient with more moderate hypoglycemia and relatively shorter diabetic duration.